Hey there, Joe 200. How are you? Man, we are coursing through this course, man. It is going really quickly. And we're going to do a little bit of biology slash psychology, and then we're going to get into social sciences today. All right. Just a heads up, tomorrow, June 5th, okay, is when your critical thinking assignment is due, the first one. Okay, it's due at midnight, but don't wait till 11:59 to submit it, okay? Awesome. As you can see by the backdrop, we have returned. We're back from Costa Rica. We did our 2 weeks with our May Master class. It was very, very awesome. It was incredibly fatiguing. And so, yeah, we got back late last night, but we're back in action. All right, guys. So let's just get right into it. Again, don't forget to get this thing done. And as I indicated there, my previous videos, I told you all about it. There is, if you haven't figured this out yet, guys, we can go right in here. There are very, very clear directions, okay, in terms of what you're supposed to do. So you just read through it right here. And there's a how-to video that I put together last semester, the same assignment, so it hasn't changed, so don't worry about it. Um, and then down here's the rubric, and you just make sure you think to yourself, okay, did I do this to get my 2 points? Did I do this to get my 2 points? Did I do this to get my 2 points? You just check the boxes, okay? You're good to go. All right, so that's it. So follow that rubric and you'll be just fine. So let's go ahead and get into this week's assignments. Okay, so like I said, um, we are kind of bridging biology and psychology today. So we're going to be psychology, mental health, and then also some of the biology of Alzheimer's disease. And then we also have it overlap with a big component of this week's instructional material, which is really the kind of individual burden that you're going to experience in terms of caregiving for your parents or your grandparents, or maybe in your community, the local society, what needs to be done, or big picture, our government and the costs and how are we going to pay for all this? Okay. All right, and we'll see, there's different ways of money going out in terms of the GDP, the gross domestic product, not only for paying for the disease, but for the lost wages that you experience and when you're having to care for somebody older. All righty, very cool. So here we are. We have, as you can see right here, 2 lectures. I'm going to do this one today. I'll do this one tomorrow, likely. All right, let's get right into it. So just 2 lectures for this week, okay? And then you'll see the midterm opens up, and it's open for, as you can see here, a full week. Once you do it, you have 2 hours to get it done, unless you have OSAS accommodations, and you should let us know about that, okay? All right, so going in here. Okay, so what we have done here, we have the American Psychological Association goes over aging and mental health in the U.S. This was a report that was done in 2017. It's a really, really cool report. The URL, they've changed their website, but we kept the information as a PDF file. So you're going to open this up, okay? We also encourage you, this is not part of the quiz. You won't find any of the information on this in the midterm exam. But if you have some curiosity, go check out the APA website, and it has some really cool site-directed information based on your specific questions and needs. Okay. Now, before we get into that, okay, we're going to remind you of what we did the previous week. Okay, we talked a lot about diabetes. Oh yeah, and I always forget to tell you that, guys, this. Don't forget, okay, to when you enter into the class, is just open up two. It's down here towards the bottom here. There it is. Open the quiz. Have either 2 different browsers open or 2 windows within the same browser. That way you can access the quiz. Okay. The theme of the information that we're going to be educating you in this week is also the theme of the discussion board. It has a lot to do with the epidemiology, which is just the raw numbers, the impact, but it's also economic epidemiology. So we're going to get the financial consequences for you as an individual, and financial consequences to our country, and how you can come up with solutions on this. Okay, so that's what that's all about. Okay, backtrack here. let's go ahead and look at what we talked about this week. Remember, we talked about diabetes, okay? It is the number one cause of disability in our country, meaning the number one disease that leads to problems in terms of being able to live your life fully, even to the point of things like just your basic activities of daily living, okay? It's a huge problem. I mean, the estimates in our country is by 2030, 60% of our country is going to be pre-diabetic, 40% diabetic. Okay, it's mind-blowing, in the numbers. Okay, when we look at the consequences of this disease, diabetes is a super high risk for cancer. Diabetes is the number one cause of heart disease, okay? Any vascular disease. So heart disease is a disease of the pipes. So kidney failure, blindness from diabetes, okay? Heart failure from diabetes. And then if you survive all that, 80% of people with Alzheimer's disease are either pre-diabetic with insulin resistance or full-blown type 2 diabetics, all right? So why is this so important? Because if we can get education out there and we can get people to change the way they live, it would really, really have an impact. So what is this specialty? This is public health, and you're a public health official, and you're trying to get people to change the way they think and the way they live. Okay, just coming back from Costa Rica, it's not a big deal down there because the food is so farm to table. All right, there's no snacks around. Okay, people eat what they need. There's always vegetables, legumes in the form of black beans, a small amount of rice, and on occasion you're going to have the protein being fish or chicken, and that's it. There's no snacking and everything like that. That's what we have to wrap our heads around. And you feel satisfied if you just wait for the message to come up from your digestive system to tell your brain, hey, you just had a meal, you can slow your roll. That message that comes up, it is Ozempic, okay? Ozempic was designed from that message that comes naturally from within us, okay? It tells the brain to stop eating, all right? Also helps you pack away the sugar so you don't get diabetes, all right? All right, so when it comes to the quiz, we want you to read the APA section about mental health, and then we want you to navigate the Alzheimer's disease website, and we'll show you how that's done. We want you to look at these two videos, okay? This one right here is the epidemiology, the raw numbers, the economic epidemiology packed on it. So it tells you how many people have it and at the cost of society that Alzheimer's is, which is enormous. Just a little bit of the biology right here, okay? The original biology where we look at what's called the pathology, the plaques and the tangles, which are basically consequences to the nerve cells dying off. That's what happens with Alzheimer's disease. Your brain cells die off, you don't replace them, okay? And that's the consequence, okay? Why it's happening, more and more people think it's happening because of the inflammation of the brain that results when you have diabetes, okay? All the candy-coated proteins, the immune system flips out, overreacts, causes the natural barrier between the blood and the brain. And your brain is very selective, doesn't let a lot of things in, okay? The barrier goes like this, the immune system leaks in and attacks. And so in some ways, it's an autoimmune disease, okay? All right, so that's what that's all about, okay? When we talk about depression, we're going to go into that article in a sec. I want you to look at this right here. You guys right here, as college students, this is the peak likelihood of becoming clinically depressed, okay? So this is the age at onset of major depression, okay? These numbers, this is old right here. These numbers don't change, okay? So you can see you're at most risk for clinical depression when you're at a very young age, and it has to do with the big changes in chemistry that happen as you're developing. You guys think you're full-blown adults. The brain really, especially the part of the brain that's responsible for depression, but also responsible for decision making and feeling like you fit socially in all the different ways, unique ways that human beings live. That doesn't really fully form until maybe 30-ish, okay? So this is why this is in such high gear in terms of depression. You see again, the age at onset. Okay, that's the key. Okay, so you might have some people, this is their first case of depression out here as their old age. All right, but that doesn't mean these people right here that were depressed when they're young are not going to be depressed as well. It just shows you the peak likelihood of having it happen. That being said, okay, we look at the worst consequence of clinical depression, and this shows you the epidemiology or the age structure of suicide resulting from clinical depression. And we see that, again, this younger age group still has a horrific rate right here. And this is deaths per 100,000 people in the population from suicide related to clinical depression, okay? But what you see is it goes up and up. So the rate actually goes up, even though the number of people that are depressed is lower. So the suicide rate is far higher in older people because they have a lot to have deep depression from. Loss of a spouse, loss of good health, loss of independence, running out of money, you can't get work. All these these psychological factors will come in and be very, very important. Okay, we're going to look right here. We're looking at ethnicity. Okay, and depression and suicide is it stems from this feeling of complete hopelessness. Okay, that you cannot overcome this, and so there is no value in life. Okay, it's not worth living. Okay, and we see the hopelessness is most significant in the American Indian Alaskan Native population in our country. So we're looking again here at rates per 100,000, and we see they have the highest rate of suicide. And it's more of a male thing. You see male versus female, okay? It has to do with testosterone, okay? Testosterone drives violent acts. Suicide is a violent act, okay? We see right here, and sadly in our country, it's mostly by gunshot because we have legalized guns. It's you look at the per 100,000 rate of death in any other country than the United States from a gunshot, and they're 100 times less, 1,000 times less. Our death by just suicide rate outnumbers the total death by gunshot in most of the westernized countries by 20, 30 fold. So it's mind-blowing, but it is what it is. It's our political system. So alrighty, so as you come through here, okay, we look, the next one is dementia. I'll get to that later. And so let's go back up here. I wanted to give you a rollout of some of the issues. And then this right here is, because I'm, you know me, I really like graphics. And so the graphics have a, just kind of a bam, impact on me when I look at it, okay? So we can then look at this publication. Again, this was done in 2017. And looking at, like I said, some of the challenges of growing old, losing a spouse, losing your mobility. I mean, it's been really hard for me to not be the kind of surfer that I was even when I was 50. Things really go exponentially. Here in my 60s, I'm just so much slower. And so it's hard to get as much enjoyment out of it. So I have to have kind of a sit down with myself and do some counseling and say, you know what, just try and have fun and don't worry about things like that. So anyways, so declining physical and mental health. Yes, I'm not as fast as I used to be. We look at my problem solving skills, much slower, especially when I'm multitasking. These are all issues that people experience when they're getting older. So the issue then is for both psychology and this again goes over all the problems. Psychology and medicine is recognizing the unique needs of an older population. Okay, when you're growing older and you have these problems, the problems skyrocket when you look at patients being admitted into long-term care facilities. Okay, and we don't have very good support for mental health diagnosis and treatment in any age group in our country, but especially in older adults. Okay, people get misdiagnosed as being demented when they're just severely depressed. Everybody thinks, oh, old age, this is what happens, and it's the wrong approach. Okay. All right, so let's go here further down. Okay, so again, mental health concerns. Okay, and we can see that a high percentage of people over the age 55 mental health. We can almost double it, maybe even triple it when you look at people that are admitted into nursing homes. So the care facilities are not equipped to handle this, okay? And when you have mental health problems, okay, it causes immune dysfunction, okay? So you're much more likely to get sick. You're much more likely to get illnesses that result in pain and problems with surgery, etc., if you have the effect of mental health problems on your immune system, okay? It also causes an elevation of the blood lipid profile. All right, the triglycerides and cholesterol, the problems that cause plaque, are elevated when you are stressed out and you have high levels of the stress hormone cortisol. All right, so like we said, we see that again, 20% of older adults and 40% of nursing home patients suffer from depression. But then we scroll down here and we look down here, even though older Americans only make up a small percentage of the population, they account for a much higher percentage of a much higher number and percent of suicide in our country. Alrighty. Alzheimer's disease, again, the numbers are staggering. I think rather than going through this, we'll just look at the informatics that the Alzheimer's Disease Association provides for us. The problem is people are not trained to be specialized in unique aspects of the aging population. This is also true, sadly, for women. Okay, so when you are female and you go to see a physician, oftentimes the medical profession is trained in textbooks, in practice, on what happens to the white male. And you go in there and you are from a completely different cultural group. You're a female, and people get misdiagnosed just because of that simple effect. Lucy, my dog missed me. Lucy's down here checking me out here. So there she is. There's Lucy. Hey, Lucy, what are you doing? Huh? What are you doing? Okay, she's had it with me now. Okay, awesome. So we need more people to specialize in aging. We need more people in finance to specialize in aging. Alrighty, substance abuse is a huge problem, okay? People will self-medicate, okay? Especially when you lose your spouse, you lose your friends, you lose your mobility. It's so easy to go down the spiral of substance abuse. Again, society doesn't know anything about it, all right? Chronic illness, okay? All these, think about one of the multiple studies have shown that the number one risk factor for having disease and short lifespan is loneliness, okay? And when you look at people that have hearing loss, vision loss, okay, lack of mobility from stroke, all this causes immense loneliness and accelerates the decline that we see, okay? Alrighty, very cool. We need more of you. So please consider getting specialized in terms of gerontology and if you're going to be a psychologist, the unique needs of the older population. Okay, awesome. All right. So the next step then is to look at Alzheimer's disease. So we looked at, like I said, we looked at the unique mental health aspects, and Alzheimer's is a form of mental disease, of course. And what you do is you go right here, and it just kind of shows you what you do to navigate. So you click right here into this puppy. Alrighty, and you just kind of show some curiosity, okay? You can look in here at the causes of Alzheimer's disease. This is the basics, the biology, some of the symptoms, okay, right here. The caregiving, there's other forms of dementia, okay? You can have dementia because you have Parkinson's disease. You can have dementia associated with just frontal lobe disorder. That's called frontotemporal dementia. Sorry, I was having slowness here. also known as Pick's disease. Bruce Willis has made this famous. I had a great friend who was an amazing surfer and artist. I'm going to scroll over here, and we're going to see. You can see the painting he made over there in the corner. So that painting right there, he was an incredible artist, and he lived in Laguna Beach. But at age 50, something happened, something changed, and within 3 years, he died from frontotemporal dementia. People with dementias end up dying not because their brain disintegrates, but they die because they get bedridden, and the immobility usually causes some type of pneumonia. Okay. So here's some key elements to learn about living with dementia. Talking to a professional. And clinical trials, are tough. They're a tough one, but if you know somebody that is suffering from this, tell them to look for some of these clinical trials in their neighborhood. All righty, so we can go over here just see how this thing works. Causes of Alzheimer's disease. So you can go in here, right here, and look at some articles and find out what's going on. If you want just the basics, this right here is just a blow-by-blow description right here of what causes Alzheimer's disease. So, for example, what is Alzheimer's disease? Okay, what is mild cognitive impairment? All right. So we can go right in here. What is Alzheimer's disease? Okay. All right. So, and you can see it's also done in Spanish. Okay. So it goes over the shrinking of the brain. Okay. It goes over some of the epidemiology. Here's the video that we posted. Okay. So this is basically what you have to do for this assignment. So I'm gonna get out of here, right here. And you just kind of navigate it, find out the information. This is the kind of shock and awe numbers. There's a brand new video that came out from 2023, but we have it listed because the quiz is based on 2022. So you can just go right in here. It's a minute long, and these are the epidemiology. This is the counting fact. 6 million Americans have Alzheimer's. And it just kind of goes through each one of those. 1 in 3 seniors. Okay. And the rate goes up and up and up as you get older. This right here describes the biology. So there's a couple different questions about the biology that underlies Alzheimer's disease.
As electrical charges travel, research has
plaques and tangles.
With the function of...
All right, so it goes over that. Okay, awesome. We scroll down here. Okay. And we see some differences here. Okay. First of all, what do you notice? You see men and women. Men are here. I wish I used a different color, but this is women in dark, in dark green, and men here in lighter green. And similar rates of dementia, except for all of a sudden then women accelerate. Okay. All right. So, and this is the prevalence per 100 men or women, and you see that. 30% of people over age 85 basically have Alzheimer's disease, okay? And women far outnumber men. We'll look at some graphics on that, okay? What's behind that? First of all, in terms of raw numbers, there's women outnumber 3 to 1. That's because men die earlier than women do. So women survive, and then they experience this disease of surviving where cumulative effects of inflammation and death of nerve cells is Alzheimer's disease, okay? The other thing that happens to women is they're protected somewhat by their ovaries and the release of estrogen. When they go through menopause, there's no more estrogen, and the protective effects of the estrogen disappear, and so their rate of Alzheimer's disease accelerates dramatically, okay? Alrighty, so facts and figures are right in here. This is an amazing website. So I encourage you to just kind of click on this sucker and check it out. You go right here, okay? And it goes over the most current facts and figures that are happening in terms of Alzheimer's disease. This is a great website, the Alzheimer's Association. So 2023 numbers, the video, okay? As you scroll down here, you can get all kinds of information that you can send out. You can download it for free and send it out to your family members and community members. All this is the outline of what happens down below, okay? So we look at here, and like I said, it's mind-blowing, 6 million Americans, 1 in 3 seniors, $345 billion, okay? Is the cost the nation in terms of 2023. It's going to go past $1 trillion in 2050, okay? Caregiving is a big part, like I said. It's mind-blowing how much time you have to spend helping somebody that has dementia, okay? Um, and that's a lot of people, 11 million, and it's actually more than that, okay, if you were to sift through it, okay? All the caregiver hours that you have to do in terms of just navigating the healthcare system, for example. Even if you're great at computers, you need to be a healthcare attorney to get things paid for, to figure things out, and monitoring doctor's visits, making sure somebody's caring for your parent if you're out of town. So this is 18 billion hours of care, okay, annually, okay, at a cost of $400 billion, okay? We see 1 in 5 women and 1 in 10 men are going to get Alzheimer's disease, okay, over their lifetime, if we look at the age of 45. So you just kind of scroll down, and again, there's lots of shock and awe numbers down here, okay? Awesome. And it goes through, what's going on. The major cause of death for people over the age of 85. And here seeing the crazy cost that everybody's experiencing. All right, so that's what that's all about. All right, so scroll backwards, okay, and we get back into this, my friends, okay, and then we put these numbers from the 2022 report, okay. Again, the numbers are kind of mind blowing, okay. I see 1 in 3, 6 million, 11 million. You look at the distribution, okay, in terms of percentage of people that have Alzheimer's disease, we see that Black Americans fare far worse, okay? This is a cumulative effect of not having intervention for healthcare. If you can treat the diabetes, if you can treat the vascular disease, then you're much less likely to have degeneration, okay? It is what it is, okay? Alrighty, and then these are just some extreme numbers to think about. These are typical age-related changes. I forget which word to use all the time. Um, what day is it? Not so much. Okay, missing a payment, that happens. Okay, that's my ADHD kicking in. I make bad decisions, sure, still, but then you look at the consistency of somebody with dementia and how it's so different in terms of how the person lived their life before. Okay. Alrighty, so we look at the cost of the nation, okay? These are just numbers based on the year that this was done. You don't have to worry about the year when these numbers were reported. We're just kind of setting the table for you. These are the things that are kind of mind-blowing here. 15% of Alzheimer's or dementia caregivers, okay, are of this age group right here, okay, and we see the average age is 27, okay, so 15% of 27-year-olds are this caregiver. Most are women. We see men right here. So this is a burden. You're trying to have your own kids and everything. You're having to care for somebody, okay? It's a big deal, okay? So you look at all these kind of shocking numbers, and this is, again, all this right here is looking at the impact on caregivers, okay, on you, okay, not the person that has the disease, okay. It interferes with your work, a third of it. People, 14% just completely stopped working because they have the responsibility of working, okay. Some people had to do it all on their own, 42%, okay. This is how many of you are in frequent communication with the healthcare system, whether it's insurance or the actual doctor in terms of trying to get things done, okay. Hands-on nursing task is a new part of caregiving that we all have to do, okay? And the consequence is severe emotional problems for yourself. You're sandwiched between your kids and your job and your parent, okay? There's lots of depression that comes with that. There's lots of financial problems that comes with that. Um, if you don't live in the same household, somebody's got to help. You're going to have to pay for that. Person next door, their caregiver costs $400 a day out of pocket, all right? So these are all things you think about. And so once you've read through this, I want you to look at the effect of Alzheimer's on caregivers right here, and a really, really touching story. And then this right here actually shows you what a demented patient is like. And so one of my favorite videos of all time. It shows you the impact of music therapy, but we can kind of scroll in here. We can watch this guy that's suffering from dementia. That's his daughter.
Okay, it's Cherry. How long has he been in the nursing home? Approximately 10 years. He was having seizures, and my mother couldn't handle him at all. Of course, it affected me greatly because he was always, fun loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop.
So you watch that video, and it shows the remarkable effect of music therapy. It's not permanent, but it still brings people out of the depths of their dementia, at least temporarily, And so music and dance and anything that can stimulate the brain is the best therapy. The drugs we have don't really work, sadly. The old school drugs, which were um, Exelon and Cognex, and other groups of drugs like that, they increase this one transmitter called acetylcholine in the brain. It doesn't really work. It's expensive. There's another one called Namenda. Okay, there's a different type of drug. It was supposed to get rid of the cause of the degeneration. It really didn't work. And even the new immune therapies, the antibodies that were supposed to then suck the amyloid out of the brain that's causing these degenerating plaques, it's not really working either. Super expensive. So anyways, the problem with Alzheimer's disease and why we're so slow is developing a new drug. You have to test that drug on somebody over years because it's a slow, chronic, progressive disease of aging. And if you're a drug company like Pfizer or Sandoz or God, it was the one in Ireland. I can't remember the one in Ireland, but if you're one of these drug companies, Eli Lilly, you can ill afford billions of dollars being spent over 5 years only to find out that, hey, it's not working. So a number of companies, including Pfizer, and there's just a Rolodex of companies, pulled the plug on all their Alzheimer's research and Parkinson's disease research because they were not getting the return on their investment, the cost benefit of doing the studies. So we're moving at a snail's pace. It relies really on academics, people like my colleague Christian Pike, who does this kind of work, and it makes things really, really slow. You compare that to cancer, where you can develop a drug and you give the person a drug, and the next day you find out, hey, this thing's working. Whereas you can do research and development and do clinical trials for 5 years with Alzheimer's and discover it's not working. So you can see why there's such rapid advances in cancer treatment, but not so much in terms of Alzheimer's. Okay, so here's your prompt. Okay, so we got to figure out something. Okay, that reduces the pain of Alzheimer's. Really, more importantly, that will help you in terms of the caregiving. We got to have some difference in terms of family leave, something that's going to help you guys help navigate this system. And it's really, really, really difficult. All right, peace, guys. I'll be sending out the next video on caregiving. You guys are doing great, and we're almost halfway through the course, which is amazing. All right, so take care.